I'm Karen. I am a dual acupuncturist and physio. One of my special interests is certainly treating people who are trying to get pregnant. I was a physio first, so coming from a very scientific background and Western medicine and coming from everything that's evidence-based, and then going on to learning traditional Chinese medicine where everything is a little bit more philosophical based and is now only just starting to become more evidence-based. When I started practicing acupuncture 20 years ago, everyone was quite skeptical of acupuncture. But now the prevalence of it is so much more and people do hear about acupuncture. I think it's amazing to be able to treat from both aspects and both approaches, from being from the Western and the Eastern approach. I see the best results when I do that, and to be able to work with whatever condition or diagnosis that they've been given. If we only approach from the traditional Chinese medicine approach, we're missing 180 degrees of it. So being able to look at it from both aspects and be that fertility detective, we can work together with both approaches to be able to get the best outcome. We see a lot of patients once they've been able to conceive. I see a lot of patients via traditional Chinese medicine and acupuncture for all sorts of things that they might be feeling throughout the pregnancy, whether it's early on in the pregnancy to help hold and support the baby, or whether it's all throughout to week 38, 39, 40, when we might be starting to do a lot more induction and helping induction of labour. Historically, the focus has always been on the woman. I think now it's only just starting to become a bit more aware in the community of how much of a contributing factor the male is. I see a lot of men and being able to guide them through things that might be able to help them. The great thing about male fertility most of the time is it can make a big change through simple things like lifestyle choices. When people are going through fertility issues, it is very hard, often for the couple, because it's not something that is often talked about to people they trust or know. If they're feeling like they want to explore those options or they're having a bit of difficulty, talk to someone that they feel comfortable with. So whether that's their GP or their fertility specialist, or someone like myself who is trained in a lot of the fertility area. If I've been able to help a patient becoming pregnant or being able to see them throughout their pregnancy and have that beautiful miracle of a child is the most rewarding thing. Then meet the baby when they come back in. It's so satisfying. Often we get emails as well of when, I've just had baby, and the baby's little picture, the baby was 3.5 kilograms, and it's just amazing to be able to see that whole journey. It really gives me my purpose to be able to keep doing what I'm doing.